1.1 million people in the United States are living with HIV. 1 in 7 of them don't know they have it. Looking at HIV infections by transmission category, gay, bisexual, and other men who have sex with men are at the highest risk. In 2014, gay and bisexual men accounted for 70% of all new HIV infections. Heterosexual sex made up 23% of the new HIV infections. Looking at HIV diagnosis by race and ethnicity, African Americans are most affected by HIV. In 2015, African Americans made up only 12% of the U.S. population, but had 45% of all new HIV diagnoses. Hispanics and Latinos make up 18% of the U.S. population, but had 24% of all new diagnoses. Youth aged 13 to 24 accounted for more than 1 in 5 new HIV diagnoses in 2015. Youth with HIV are the least likely out of any age group to be linked to care or have a suppressed viral load, meaning there's non-detectable levels of the HIV virus. Older Americans, people aged 50 and over, account for 45% of Americans living with HIV. Socioeconomic status is made up of income, education level, financial security, and perception of social status and social class. It shapes a person's quality of life as well as opportunities and privileges people have within society. HIV affects those of lower socioeconomic statuses and those who live in poverty at high rates. Limited economic opportunities and homelessness are associated with riskier sexual practices, such as exchanging sex for money, housing, or drugs. Income inequality is also related to increased HIV risk for males, whereas poverty, health, and housing circumstances has an increased risk for females.
My whole family disowned me. My aunts, my uncles, my brothers, my sister, all my relatives, my cousins, they disown me. Positive people don't have any rights anymore. They're just a statistic and a number now.
Since HIV weakens the immune system, a patient can become highly susceptible to numerous infections. TB is the leading cause of death among those with AIDS. Cytomegalovirus is a common herpes virus that can cause damage to the eyes, lungs, and other organs. Candidiasis, a common HIV-related infection, and causes inflammation and a thick white coating of mouth and tongue. Cryptococcal meningitis is a common central nervous system infection. Kaposi sarcoma is a tumor of the blood vessel walls and causes lesions of the skin or mouth. Lymphomas originate in white blood cells and usually first appear in lymph nodes.
When they're looking for a certain person, they'll say, you must be clean. So I'm being profiled as being a dirty person because I'm HIV positive, which is like farthest from the truth. So there's a stigma there for sure.
It actually really sucks. For instance, on Grindr, I've been blocked when I've been like open and honest. They solely look at your diagnosis, categorize you like most of us do in America, put you in a box, and then kind of shove you off to the side.
The team consists of a primary HIV healthcare provider who can be a medical doctor, nurse practitioner, or physician's assistant. Mental health providers such as a counselor, psychologist, or psychiatrist to provide counseling, and social service provider such as a social worker, case manager, substance use abuse specialist, and a pharmacist. PrEP is the concept of using medications to prevent HIV before exposure occurs. It's called Truvada and is more than 90% effective when taken as a pill once a day. However, many patients struggle to gain access to PrEP care. In a study, 2/3 were not prescribed PrEP because of discomfort or lack of knowledge from the PCPs. Ryan White program is for those who do not have sufficient health care coverage. TheBody.com and CDC Network is a database of organizations offering support services. The National Minority AIDS Council offers a directory searchable by services provided, languages spoke, and population served. Affordable Care Act increases access to primary care services for at-risk populations. However, not enough PCPs are knowledgeable, so patients have to find another way to gain access to preventative care. Section 504 and Title II prohibit discrimination by state and local government, and HIPAA protects the privacy of health information. Effects of HIV on physical and mental functioning can make having a stable job difficult. Many people with HIV find their work responsibilities conflict with their healthcare needs. Unemployment rates for those with HIV can range from 45 to 65%. In some rural areas, the health service organizations have high reports of predisposing factors such as stigma, resistance to providing care, and confidentiality issues. This affects their ability to provide care.
That, I'm giving people AIDS on purpose, or that I am infecting people, that I'm going to die, that I deserved it because I'm sexually free or sexually liberated, so I deserve it, that I'm a slut.
Stigma can socially isolate and inhibit people from seeking social support or continuing healthy behaviors. It can compromise self-esteem, mental health, and adherence to treatment. As a result of HIV or AIDS-related illnesses, some are unable to work. Those returning to the workforce have some obstacles listed here. Due to some work regulations, some patients may need to work even if they are sick in order to keep their job. Some patients have difficulty with adherence. 86% of those with HIV know they're infected, but only 30% achieve viral suppression or undetectable levels of the virus. Some have to focus on their basic needs first, such as food, shelter, and safety. They can't focus on their health because they have more important needs to be met first. Self-care can also take a backseat when managing this disease. Financial burden is also a factor because of the cost of daily medication for the rest of the patient's life, transportation to pharmacy and doctor visits, co-pays, and any additional treatment or counseling. Attending support groups can serve the purpose of sharing experiences, encouraging disclosure, reducing stigma and discrimination, improving self-esteem, and enhancing coping skills and supporting medication adherence.
My first official group meeting was at RAIN. That gave me a huge confidence boost because there are people out there who accept it and who are knowledgeable of it.
Nothing, I think, as impactful or as powerful as the youth that sit and talk about what it's like to live with the virus and what it's like to take a pill, especially in a southern state.
Secondary diagnoses of anxiety disorders and other disorders disrupt social participation for individuals with HIV. Negative states such as depression, anxiety, or shame impact engagement in sexual activity. We also have to consider the willingness of the negative partner to take the PrEP pill every day to have safer sex. 25% of HIV-infected parents avoid common physical interactions with their children. Beyond legitimate fears of exposing transmission through blood, many were afraid of activities such as sharing food, kissing, and hugging. Lack of sleep is associated with disease progression, medication therapy, employment status, and lack of knowledge about behaviors that promote good sleep. Fragmented sleep, which is difficulty staying asleep, occurs in chronic health conditions and may not even be perceived by the patient. Some drugs used to treat HIV and illnesses associated with it also cause insomnia.
I need to talk with people who really wanted me to be me.
And it took me a long time to want to stand up and say that this is who I am and be proud of it.
I started to think about, what is my life worth?
I chose to be empowered with knowledge and a support system so that this epidemic would miss me.
HIV ends with me because I'm going to bring it up. I'm talking about it. be educated about treatment and prevention and how you're affected whether or not you're infected.